Hello everyone, welcome to another episode of Health Tech with Purpose. Today we have Karl Ulfers, co-founder and CEO of DUOS, joining us on our show. Karl shares insights into the journey of DUOS and how they leverage technology to increase accessibility and access for older adults in navigating the complex healthcare system. Tune in for an inspiring discussion on the intersection of technology, healthcare, and social impact.
Hi, Carl. How are you today?
I'm doing great. Yeah, it's a wonderful morning here in Minneapolis.
Great. Was looking forward to this conversation. But before we start, into the details, I want you to start by telling a bit of your background and how it was for you growing up. Where did you grow up? Where did you go to for college?
Yep.
Where did you learn your lessons? Let's start from there.
Yeah, sure. Yeah, I grew up here in Minnesota. First lived in Minneapolis, and then actually grew up in a suburb from elementary school on of Minneapolis, St. Paul, called Eagan. That was a really fast growing suburb. I think when we moved there, it was like 7,000 people, and when I graduated high school, it was like 70,000 people, all in the period of about 13 years. Growing up, I was both played a lot of sports, football, hockey, baseball. And then I also was one of the rare kids that was also in the choir that we had at our school. Our school is known for sort of its theater and choir programs. From there, I went to St. John's University in Minnesota. I got an economics degree there. It was a tremendous place to learn and kind of grow. And then from there, actually went and worked for a software and consulting firm based out of Lake Oswego, Oregon, just outside of Portland, Oregon. And that's where I really, fell in love with the health tech space. While I was actually in college, I was actually an institutional equity trader intern. And so I spent a couple of years doing that. And that I did that long enough to realize that, working in the big institutional money side of the world was not what really got me fired up and excited, but working within the healthcare and health tech space and a space where you can really feel like the work you're doing is helping the world be a little bit better place was really exciting and motivating. And that company was a great place to start. And from there, then that company had some roots in Andersen Consulting, if you remember that firm from way back when. And you're probably familiar that United Health Group had some roots in Andersen Consulting. So I was actually part of the small team that helped create Optum Health way back when in 2008, and did that for a number of years before moving back to another small company called Audex that I joined right after their Series B. And that ultimately became Rally Health. And that's where I sort of went from being the chief product officer into CEO of that company, taking over for the founder of that company, a guy by the name of Grant Verstandig, who's been incredibly impactful with his career and his entrepreneurism. And that led me to DUOS. So that's where we started this company. But that's the quick flyby on my background and my experiences.
Okay, great. So, you would be the best person to describe DUOS. So, what you guys do at DUOS, and if you can explain it in the most layman terms, the value that you create and the benefits that you have brought to the world, please tell us more about that.
Yeah. So, DUOS, I was passionate about starting DUOS for two reasons. One is my entire professional career, as I just sort of described, has been focused on that intersection between technology, healthcare, and helping individuals navigate the system a little bit better. And over the course of helping lead Rally, my grandparents are actually both still alive. They're 95 years old, and I got to see firsthand how fragmented the healthcare system was for them, and not just the healthcare system, but the entire aging experience that they had. It was very complex and very challenging. And they, like a lot of older adults, wanted to really continue to maintain control, but they also knew that they needed more support. And it was so complex that was frankly very hard for them to accomplish both of those objectives. And so I was really excited about starting DUOS because I felt like the experience that I had in terms of leveraging technology to take a really fragmented healthcare system and simplifying it for people could be applied into the older adult space. And the reality is that, there's over 60 million older adults, people that are over 65, and you've got over 40 million caregivers. And so if you take a step back, that's over a third of our country is being impacted as the country continues to age by, frankly, just a not great system in helping them navigate and get their day-to-day needs met. And so that was really the impetus and what I was so excited about to start here at DUOS. So yeah, does that make sense as I sort of explain what got us started?
What I would like to know more about is, like what was that missing piece that you created as DUOS, like I would say the competitive advantage that was missed before Duo came into existence.
Yeah, for sure. I think it always starts for us back to what we really want to get done for the older adults. And we are very passionate that we want the older adults not just to maximize the number of years that they live, but to maximize the life that they get from those years. And the competitive thing that we've really focused on to help those individuals maximize their day-to-day lives so they can maximize their overall life is really helping them on the things that are typically pretty fragmented and hard to find, which are as follows. Food, really hard for a lot of older adults. There's a lot of food insecurity. A lot of older adults, as is well known, have a hard time driving. And so transportation starts to become a real barrier for them. Staying in their home, which older adults, vast majority want to stay in their home, becomes really challenging. Everything from just simple things like making sure that they've got the heating and cooling that they need to helping, fall proof their homes with things like bathroom rails, fall prevention tactics that need to be deployed, are just become really overwhelming and challenging to those individuals. And then finally, helping them get the medical appointments and the medications they need to receive the quality of healthcare that they deserve also becomes really challenging. So if you think about those need states, the reality is underneath those need states, there is a big challenge that most older adults that we work with face, which is they don't have the financial resources that they need to actually pay for the services that will help them in each of those individual areas. And so what we have done is we've actually aggregated every single Medicare Advantage plan, their benefits and their coverage structure in the country. It's over well over 4,000 Medicare Advantage plans and benefit structures we've pulled into our system. We've done that through an integration with CMS. In addition to that, we've pulled together every state, every federal, every VA program in the country as well. And so what that has given us is this vast set of resources that can help pay for these services that these older adults need, that I'll be honest with you, 88% of the time when we start working with these older adults, they have no idea what their benefits are. They have no idea what these government programs are. They have no idea how to tap into these resources that can provide them with the finances they need to get the services that actually help them live the quality of life that they deserve. So that's the key asset that we've sort of built that gives us a really nice differentiation as we're working with our partners, which are Medicare Advantage plans, as we engage with their populations.
Right. And I could see on your website, those stories which have brought really happiness to all the people who have been your users and, older people with smaller things that, that may look like a very small thing for a young person like ourselves, but could be a very important thing for them, and they are not able to find the way. And I think, if you're able to solve at that moment, I believe that, that makes all the difference. Yeah.
Well, and just to really emphasize that point about at that moment, the reality that we find time and time again is that these older adults, they'll forego these services for months and years, and they'll make really horrible trade-offs, like trying to decide between the food that they buy and the medications that they can receive, because they don't know how to get access to these benefits and services. And so to your point, one of the really cool things about our culture that I love at DUOS is every single week, we actually send out to all the company basically a member story, a person that we directly improve their life through our technology, and then oftentimes through the support that we offer around that technology. And those stories are what really, frankly, fuels us in the really challenging times of being a startup, because these are people, again, that oftentimes have gone months, if not years, without being able to get that service. And in that moment, we're able to connect them and get them the services that they need, and it really makes a huge impact to their life.
Yeah, and another thing out of curiosity is, how much of the whole service to the older citizens is technology for you, and how much it is human driven. So at DUOS, what's the kind of mix, or how do you see it?
Yeah, one of the things we're really excited about is how we've been able to leverage technology to engage with these populations. There's a lot of, frankly, misnomers in this population that these older adults won't engage in technology.
They may not be using technology. Yeah. So
yeah, but we frankly find that's not the case. So let me start by just talking about like the average person that we work with. So the average person we work with is 74 years old. They make $28,000 or less a year and in income. It's well documented the older adult population does not have the savings that they ideally would have. So we're dealing with people that are really financially constrained. We do tend to see more females than males. That's pretty standard within the older adult population. But what we have really found is that 60% of the time, our interactions are digital, and digital can mean, whether that's using our site or whether that's using text message, but is digital interaction from their actual phone. And that is a really important insight for us, because a lot of people would assume, and a lot of our, frankly, payer partners assume a far lower rate of digital utilizations in this population. And one of the reasons that we've been able to really get that level of engagement, and we think, by the way, we can get that up to 85%, is because we've really spent a lot of time understanding the differences in how you engage with an older adult from a technological standpoint versus, say, you and me as an example. So yeah, it's been a really interesting learning for us.
right. But was that something that like you guys realized over time building the product, or was that something you were very clear right on day one that older people do use technology?
Yeah, I always like to say that you're going to be more wrong than right when you first build a company and a technology. We started actually with a very heavy sort of telephonic one-to-one operational model. We got a lot of learnings from that. That's actually how we figured out that there is a strong desire for more digital interaction. And we also really deeply were able to understand the needs, those kind of big five that I mentioned earlier. But we've got a very strong culture of test and learn, because there's a certain amount of strategy and research you can do up front, and then there's a certain amount that you just need to watch the data and see how people are interacting. And one of the coolest things is I would tell you is when we first started to launch our digital capabilities, we started out at about like 20% of the interactions were happening digitally. And then progressively, as we've learned, as we've tweaked the technology, as we've made improvements, we've seen that steadily increase to the 60%. And like I said, we think we can get that to about 85%. Let me give you a real example, though, of like a change that we made. It's pretty standard for any digital experience that you're going to have a username and password, or you're going to have a login with Google, or pick any one of the different authentication services. What we found with older adults is that worked fine, but it was still confusing. It was still another thing for them to have to remember. And so what we deployed actually that drove a really big increase for us was Magic Link. where they just simply have to put in their email, and then it sends an email to their email where they can click on basically a secure link that takes them directly into their experience. And that little tweak literally over doubled our digital utilization for these older adults, because they all know their email address. We like to joke like one of the greatest things that happened during the pandemic was all the older adults got on, or a lot of the older adults got on Facebook. And what do you need for Facebook? You need email. And so like everybody knows their email. So that little change, which was technologically pretty sophisticated because of how you have to do it within the healthcare space, made a massive increase. Like I said, over doubled overnight our use of digital by this older adult population.
Mm-hmm. Nice. And when building, let's say, especially technology for older adults, what have been some of your learnings, just like the one you shared just now? What have been other learnings, if you could expand on, as a system thinking? Like, when you have a ideal customer profile as a 74-year-old, for example,
Yep.
what kind of decision making you have seen, that goes into
Totally.
choosing between features or choosing between the communication medium and stuff like that, if you can expand that.
Absolutely. Yeah. So I think one of the most important things as you think about system thinking and building sort of engagement loops for older adults, or for any user population, is to really understand like making sure you land on the right what's in it for me factor. Like what's in it for me, and like how do you actually pull that all the way through the experience. And this is, again, as an area where we really test and learned to get to the right what's in it for me for the ideal customer profile we started. So let me just tell you about that journey. So we started by thinking, if we really market around the idea that these older adults, because there was a lot of social isolation, we launched the company in November of 2020, that if we really focused on marketing and our product around helping them not feel so socially isolated.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
That would be a good way to get older adults in the experience. What we found is yes, we found a lot of rates of social isolation within our population. We're about double. Over 40% of our members would actually identify as being somewhat socially isolated, which is about twice what you would expect. However, that was actually not that compelling to them. So the next learning we had was like, these older adults really want to maintain control. Like they want to be able to continue to live the life they have for the previous decades. So then we started to market to the older adults around aging independence. Well, we found that worked. That got us a little bit more activation. That sort of helped us build a better product. But then we realized, the biggest barrier that these older adults are having relative to living independently is actually that they don't have the financial resources that they need to pay for the services that will help them maintain independence and control. And so that's really this part of the journey that we're on right now. And we feel very confident about this from a product and a user standpoint, which is the primary job that we have for these users is to help them get the financial resources that will pay for these services that they need. And then to your point, that rips through the entirety of the product from a product loop standpoint. Our landing page and our messaging on that when we're activating people highlights our ability to help get them the financial resources they need. As we are activating them and asking them about their needs, we're constantly reminding them that we're going to help them get access to benefits and programs that will help them pay for these services. And then even from a feature set perspective, even within the experience itself, as we're connecting these programs, each step along the way, we're highlighting the amount of financial support that they can tap into once they start using these benefits for these services that they need. So I love that you asked that question, because that journey has been incredibly important for us. And then you asked another question within your question, which is like, how does that impact prioritization? We're constantly challenging ourselves to say, like, we could do this, but is it actually helping that older adult get access to those services or to that healthcare that they need and feel like they're going to be able to get it when they previously haven't? And so we're constantly pushing ourselves in that regard.
Nice. And in fact, I'm glad that you touched upon, choosing between features or choosing between privacy versus convenience and so on. And I also saw that, you use a lot of AI today as a company,
Yeah.
what I could read again. So tell us more about, your version of AI, like how does Duos goes about using AI. Again, what are the ways that you have already used AI? What are some of the ways that you have deliberately avoided using AI? Tell us more about that aspect.
Yeah. So AI has been a really wonderful component of what we've done, and been a big lift, frankly, for our engagement model with older adults. The headline is that the two big themes that we focus on from an AI perspective at DUOS is how do we leverage AI to increase accessibility, and then how do we leverage AI to increase access into everything that we do as a company. And let me tell you that we actually started not using AI. We actually started when we were thinking about this problem space of how we match an older adult to benefits programs and services by building a search engine that had a pretty complex ontology associated with it. And about a little over a year ago, right about a year ago, this all of a sudden OpenAI and ChatGPT started making a lot of noise in the world. And so I said to my CTO, Art Petrosin, I was like, hey, we should look at their large language model and just see like how it would do on a problem space that we're focused on. He came back to me 2 weeks later. He had one of his top engineers work on it. And what we had found was that large language model was doing a better job than the search engine we had developed for 6 months at understanding older adults' needs and matching them to the right program for those needs. And so that really allowed for us to realize there's a lot more we could be doing with it. And it's not everything that we do. There's a lot of other technology we build around it, but it does play a really important role. And when I talk about those two themes of accessibility and access, I'll just give you like two very simple use cases. Look, the reality of the older adult population that we're dealing with is very diverse, both in terms of languages and the level of English language that can be spoken, whether that's spoken or whether that's chatted to us in our digital experience or over text. It's a very wide array, and frankly, it's very, very limited. And so one of the things that I'll just give a real example of, beyond the fact it can understand lots of different languages, which is super powerful in and of itself, even fragmented English language it can handle incredibly well. So one of the stories I always like to tell is we had a user that literally typed in, I am afraid, like FRAID, of fallen in my bathroom. So not like very few words actually inputted correctly. And the model was able to actually figure out that this person was afraid of falling and a fall risk, and was able to like not just connect us to them, but also get them connected to a bathroom modification benefit that they had on their health plan. So that's what I mean when I say accessibility. It really opens up that aperture of how you can scale and help more people.
Mm-hmm. Okay, yeah. You covered like the different ways AI has been helping. Just to touch upon like any deliberate choices in terms of avoiding any aspects of AI that you have like kept it on a back burner, not to use it, especially from the viewpoint of ethical AI or the privacy or security and so on.
Yeah, look, again, we stay focused on these two key themes of accessibility and access, because we feel like those are the most powerful ways to use it. And to say what's unsaid when I say that, what we don't think it's great for at the moment on its own is denial of things, right? Using AI strictly as a way to make negatory decisions, we think is not the best use yet, maybe ever, of determination of whether somebody should have coverage for something as a matter of fact. And so what we really try to do is again focus on that accessibility, and then on the access side, the way that we focus on it from a positive standpoint is we have built our own machine learning model that sits on our side. It takes every interaction that we have, and so when the large language model figures out the intent of what that individual is doing, we're training it based on the experiences of like people that we work with within our company to find the best benefit, the best program, et cetera. And I would say that's the opposite side of that. That's the other thing you have to be so careful about with AI, which is you have to remember that AI at its core is two different problem sets. There's a learning problem set, and then there's an inference problem set that sits on that learning.
Right.
And what you train the learning engine component of AI with is so important. And I think this is where you can get into a really challenging spot. Whereas if you're not using data from like people that you're servicing, or you're using data that's inherently biased in one way or the other, the learning itself will then generate inferences that are not what are the best for the people that you're servicing. So that's the other thing that I always explain to people as they're thinking about how to use AI, is just be really careful about how you think about that learning layer.
Right. No, thank you for saying that, because that's so important. So, another thing that I would like to touch upon, again, is, for the audience that you're catering to, especially, the engagement and the personalization is super important. And tech is a great enabler, of course, to be able to do that. How has DUOS been able to use technology, to make healthcare engaging and personalized for members? Because you're dealing with an audience which may have which may need to be convinced that this is useful to them, and this is not noise. So they tend to be choosy, from what I understand from my own parents. So
Yeah. I mean, look, what I would tell you is this is where it's so important to take a step back and think about how you're leveraging the technology and the way that you're going to market with technology. And for us at DUOS, we are fundamentally a B2B to C business. And the way that we have to think about leveraging technology to drive activation is so critical relative to the way that we actually are working with the partners that we're servicing. Even though the person that buys our service and technology is somebody that sits at a health plan, the users are the people that the health plan serves, right? And so the reason I say this is where we think the power of digital technology and payer data sets, and then these broader government program and benefit data sets come together to really create a simple experience for the older adults that we get the privilege to serve. And so I'll just give you a couple of real market examples that sort of illustrate how that technology comes together. You might have seen that we recently did a launch with Humana. We got a bunch of press with Humana and their veteran populations. The reason I highlight that is it's a perfect example where we already had Medicare Advantage benefit data. We already had a bunch of state and federal program data. And then we also brought in all this veteran program information. The reason that's so important is think about yourself as a veteran that is on one of these Humana Honors Medicare Advantage plans. Not only are you trying to figure out how I navigate the VA benefits, I'm also trying to figure out how I navigate my Medicare Advantage benefits. And oh, by the way, if there's the other programs that are out there from the state or the federal government, my head is basically exploding because lots of these programs overlap with one another. And that's if I even know about them. So what we have done is we again have built that sort of data supply across all those different programs. But the end user, they don't care about that, right? They care about like, hey, I have a need. What can you do to help me with that need? And so the way that we've actually built the technology is it takes all that complexity of those programs and benefits. And then when we figure out that an individual say, they need to get connected to food resources, rather than like just dumping a whole set of like benefits and government programs and VA benefits and other stuff on them, we use that technology to actually orchestrate a journey that will help them say first, for example, get connected with the food benefit that they have as part of their flex card. Next, we'll help them get connected to SNAP and EBT benefits so that they have that from an ongoing standpoint. So that simplification of that complexity down to that unique user interaction is how we then leverage the technology to meet that member's need. And as you probably know, once you meet the need of somebody, the chance that they're going to come back and be loyal to your technology and the service that you're providing is exponentially higher than just having some really slick technology. So we try to stay very purpose-driven on how we use all this data and this technology to lead us into our experience. The other thing I'll just say, just because food insecurity is such a big challenge with these populations that we serve. One of the partnerships that we've again really thought about from a technology standpoint is we've got this marketing campaign you'll hear us talk about called Connections for a Cause, and that's on our B2B marketing side, right? But what we've done with that is we've actually used that to generate over 8,200 meals that have been delivered from U.S. Hunger because of that marketing and those dollars that we've raised for people that U.S. Hunger and ourselves serve. And so it's another really good example where the way the technology comes in is a supportive factor to this need state that we just see in such a high prevalence with the populations that we serve.
Mm-hmm. Makes sense. Totally makes sense. So that's fantastic. So the next question I'd like to talk more about would be about the future. So like Karl, what do you see as the future for DUOS and also for adult population? So what are the newer trends or new opportunities or possibilities that are coming up in what we can say is care for adult population, and how especially with technology we can harness that trend or be able to be a participant to that trend?
Yeah, so let's start with like the big trends, right? That I think are hopefully well known. We're going to have more and more older adults in the country as ever had before. And so as that happens, there's going to be more strain on the existing aging system than there has ever been previously, both for older adults as well as those family caregivers that are, like myself and my family, that are trying to support the older adults. Coupled with that, we're going to be living in a world where not only do those older adults have less from a financial resources perspective than previously, the federal government, which has been a key resource for older adults from a Social Security perspective and from a Medicare funding perspective, inclusive of Medicare Advantage, is more financially constrained than it's ever been. And so I set that backdrop of more people, less financial resources, to then say technology has got to play an absolutely enormous role in bringing greater scale and greater impact to those populations than have ever existed previously. And the good news is this older adult population, as we've seen ourselves, but as you can really see in the baby boomers as they're coming into this population, are more technologically savvy than they have ever been. And so as we think about the future from DUOS, I will keep it really simple in terms of a couple of key patterns. One is we're going to continue to look for innovative ways, whether that's voice, whether those are devices in the home, whether that's just enhancing the existing technology we have, to open up the aperture of how people can engage with us. You hear a lot about VR. I think that is still a little bit out for this older adult population. But I think there's lots of different ways that we can be innovative and be opening up the aperture in which ways people can engage with us. And we're going to continue to stay very curious and really test what works the best with those older adults. And then on the back end of this, look, if you think about the way that you get a ride every day, or maybe not every day, but on a frequent basis from an Uber or Lyft, if you think about the way that you can order food, for your family, if you think about the way that you can schedule things, we think that all that technology advancement that has come about in basically every other category in a consumer's day-to-day life has got to come into this aging space, both in the healthcare sector, but also in these sort of social needs that we support individuals on. And so that's the other area that we're going to continue to be very, very focused on is how do we make that final mile connection as absolutely seamless as possible for the people that we're servicing? Because today in the industry, there's so much wasted labor and expense in that orchestration, and so much of that can be automated with really focused use of technology, and frankly, just taking what's already been done in other parts of the economy and bringing them into what should be there and really easy for the older adults that we serve. So I'll use those two sort of bookends is where we're really excited about the future and where we're focused on continuing to improve things.
Great. No, awesome learning from you about the possibilities, Karl. And, all along, it's been a great masterclass to learn about the care for adult population. And thank you so much for sharing your thoughts. It's been a pleasure hosting you.
Yeah, absolutely. Thank you for having me on, and look forward to talking again in the future.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.